Right now, a lot of people are focused on getting healthier, especially as we head further into the new year. And for some, it's not just about diet and exercise. There can be underlying factors that make weight loss and energy levels more complicated. I spoke with Valley Medical Weight Loss about how they can approach treatment and why their personalized care makes the difference in everything that they do. At Valley Medical Weight Loss, they believe real health is built with intention. Long before hormone optimization and metabolic care became mainstream, their physicians were already addressing the real drivers behind weight gain, low energy, aging, and performance. Joining us today to talk about the services they offer is Dr. Jatta and patient Eric. Thank you both for joining me this morning.
Thank you so much for having us.
So we really got to talk about, a lot of men say they do not feel themselves anymore. And I think men put that off without really getting that check to find out about it. Let's talk about low testosterone.
Yeah, so low testosterone, this is a very common in men as we age. We can go through what we call andropause, whereas your testosterone decreases over time. So, and this can be associated with some of the symptoms patients can present with, such as low libido, lack of sexual drive, or also they can have an issue such as fatigue, which is another big one for many men, but also weight gain is another big factor. And then lack of muscle mass is something that they struggle with also. And cognition, they have a difficulty with their memory lapsing. Overall general decline in their wellness, also they can also notice that as well. So psychological aspect is mainly you have mood issues. You become more irritable, more anxious, and they are feeling more depressed and more sad. So men can experience that when testosterone declines. So that's something that we always encourage patients to look into, finding an HRT doctor who specializes in addressing the root cause, because there could be some potential for other deficiencies such as vitamin D, thyroid, metabolic issues, medications, other disease process can be underlying cause of why they're having those symptoms. So that's why we are here to actually address those for men who are in need of hormones.
And I love that we're able to have this conversation now. And I've always said that when we're transparent about what we're going through, we're able to help so many other people. So Eric, I want to just ask you and just talk about a little bit of your journey and how we got to where you are now.
Yeah, lucky for me, I did find Valley Medical and Dr. Jatta. I think as we get older, I'm in my 50s, we don't necessarily talk amongst men about our testosterone levels or about what's wrong with us. We just assume, oh, I'm getting older, or I've gained some more weight and things like that. But one of the nice things about Valley Medical and Dr. Jatta was that he does look at more than just, okay, your testosterone levels, looked at my thyroid levels and all of that, and took it as an entire package to help me out with energy level, with libido, weight loss, all of those things that we don't necessarily talk about amongst men. We just assume that that's part of life and that's what we have to go through. So to have a supporting facility and doctors that care and look at that whole picture means a lot to me. It really has changed my life.
And Dr. Jatta, a lot of men chalk this up to, I just need to go hit the gym. I need to go outside and do something. But there's so much more beneath that.
Yes. So a lot of men actually self-diagnose nowadays. They just go to the lab sometimes, you can do that, and they run their testosterone. And they forgot the fact that we needed a free testosterone. We need to make sure you don't have a thyroid issue. We want to make sure you don't have adrenal insufficiencies. Your vitamin Ds are perfectly checked also, right? So we look at the overall picture. That we can actually kind of find the root cause why you are feeling the way you are, right? For example, if you have an erectile dysfunction, it could be prostate issues. So they may not even understand the fact that their urinary issue or their libido issues due to prostate. So all of those are included in our package in terms of, so we can get a specific diagnosis, because without the diagnosis, we are just throwing things at you.
And want to finish it up, wrap it up with you, Mr. Eric. How does it feel now to just have your life back?
It's amazing. I mean, my activity levels, my ability to spend more time with my friends, golfing, I like to hike, all the things that my wife likes to do. But some of those things, like we'd go on a hike, she'd go for like 6 miles, and I'd go for 1.5 miles because that was it. That's all I had the energy for. That's when I was starting to get fatigued. But I actually have that back now after being treated and having them do that entire scope. I also have a thyroid, and that was something that he was able to get from the blood work and help me with everything, not just the testosterone.
Dr. Jatta, you are in the helping business. You want to help so many other people like Eric. Tell us about the special offer you have for our viewers.
So we currently have a 58% off on your lab work, including consultation, which is a very comprehensive lab work. So once you show up, we'll definitely honor that discount for you.
Dr. Jatta, thank you for the amazing work that you and your team are doing. Mr. Eric, thank you so much for being transparent about your story.
Yeah, thank you.
And if you'd like to learn more information, you can go to the website or call the number you see on your screen.